The World Health Organization has declared a public health emergency due to a recent monkeypox or mpox outbreak in many countries. Monkeypox is an infectious disease caused by the monkeypox virus. It is similar to smallpox, but generally less severe. The virus was discovered in 1958 in Denmark in monkeys kept for research. But the first human case was identified in 1970 in the Democratic Republic of the Congo. Monkeypox mostly occurs in Central and West Africa, but recently we have seen cases popping up in other parts of the world. Signs and symptoms of mpox often appears 1 week after exposure, although they can also appear 1 to 21 days later, usually lasting 2 to 4 weeks. Symptoms can last longer in people with compromised immune systems. Typical mpox symptoms include rash, fever, sore throat, headache, aches in the muscles, back pain, and enlarged lymph nodes. Following these flu-like symptoms, a rash typically appears, often starting on the face and then spreading to other parts of the body, including the hands and feet. While some people may only have a few skin lesions, others may have hundreds or even thousands. These can show up any place on the body. The rash goes through several stages. First, it's flat, then raised bumps, then fluid-filled blisters which eventually crust over and fall off. It's not a pleasant process, but most people recover within 2 to 4 weeks. So how does monkeypox spread? The virus can be transmitted from animals to humans through close contact with the blood, body fluids, or skin lesions of infected animals. However, monkeypox can also spread between people. This happens through close physical contact, respiratory droplets, mother-to-child, and contact with contaminated objects like bedding or clothing. So who is most at risk? While monkeypox can affect anyone, certain groups are more vulnerable. These include children, pregnant women, and people with weakened immune systems. Also, those who live in or have recently traveled to areas where monkeypox is more common should be extra cautious. Now, the big question is, how do you protect yourself from monkeypox? Prevention involves a few simple steps. First, avoid contact with animals that could harbor the virus. If you are caring for someone who is infected, wear protective clothing, including gloves and a mask, and avoid sharing personal items. Hand hygiene is also important. Wash your hands frequently with soap and water or use an alcohol-based hand sanitizer. And if you suspect you have been exposed to monkeypox, it's important to isolate yourself and seek medical attention immediately. Identifying mpox can be difficult as other infections and conditions can look similar. For these reasons, testing is essential in order to have people treated as soon as possible and stop the spread of the disease. The recommended laboratory test for mpox is polymerase chain reaction or PCR detection of viral DNA. The finest diagnostic samples are obtained by forceful swabbing of the skin, fluid, or crusts straight from the rash. Oropharyngeal, anal, or rectal swabs can also be used for testing in the absence of skin lesions. It is not advised to test blood, since antibody detection techniques cannot distinguish between distinct orthopox viruses. They may not be helpful. There isn't a specific treatment for the monkeypox, but because it's similar to smallpox, antiviral drugs and vaccines developed for smallpox may be used. In fact, some countries are already offering the smallpox vaccine to people who have been exposed to monkeypox or are at high risk. Best defense is prevention, so stay informed and take the necessary precautions. Stay safe from monkeypox.